Welcome to Positive Filter with your host, Philip Wilkerson, a podcast that focuses on friends, family, health, and career with a little self-help around the way. Please join me in this journey for self-improvement, and I hope that what I have to share will make you a better person, thus making the world a better place. Hey, ladies and gentlemen, boys and girls, it's Positive Filter thing. It's Philip Wilkerson, the host of Positive Filter, back with another episode of Positive Filter. I'm going to say Positive Filter about 4 more times. Tonight, I am joined by a very special guest. I say that because everyone is special to me. I'm joined by my brother, LaMarcus Davis. Now, I'm going to give you a little explanation. LaMarcus is the most wealthy person I know. I'm just joking, but I'm just teasing. But he's also a great brother. And as a career counselor, I'm always looking to interview or have people on my podcast that have a wide range of careers and share that career advice with other people. So I'm not going to talk about his career because I want him to give an explanation of his career. But thank you for being on the podcast, LaMarcus.
Appreciate it.
Tell the listeners a little bit about yourself.
Yeah, okay. So again, my name is LaMarcus Davis. I'm originally from the Southern Virginia area, small town called South Hill, Virginia. Many people may not know about that. Born and raised. Was there majority of my life, and then went to North Carolina for undergrad in Shaw University, the oldest historically black college and university in the South.
Oh, the South. Okay. Not in the country.
Oh, the South.
Okay.
Yeah. Established in 1865. So went there for 4 years, majored in biology with a minor in chemistry. Then went back to Virginia for graduate school, and then been in the lovely DMV area for the time being. And
so you did a little bit, you just said biology, science, blah, blah, blah.
Right.
But let's tell the listeners, what do you do?
Right. So clinically, my profession is one of the many hidden jewels in medicine. And so because of that, it's not always the easiest to explain.
Okay.
So I'm considered a board-certified surgical care practitioner. And with my profession, it has many different names and credentials. And basically, it depends on the person's track. Like whichever route they went or if they was already in medicine.
Okay.
So a surgical care practitioner could be a doctor of medicine, a nurse practitioner, a registered nurse that has her BSN that went to get additional surgical training.
Okay.
A surgical technician that went and got additional training similar to an RN, went back to school, got more training.
Okay.
Or you could be a surgical first assist, went to a more board certified graduate program. So there's so many different tracks. I mean, originally it started in the military.
Okay.
And now that track is grandfathered out, basically. So yeah, so it's many different titles and professions.
So you do surgery.
Yes.
You're in there. You're in the trenches. Now, this is going to be an episode. This is really going to be about different occupations in medicine. I know. I probably when you talk to people and you say this, the surgical thing. Do people always automatically call you Dr.
Yes.
Davis?
Yes, they do.
And what was your decision when you were going? You're going to Shaw, and you're like, I'm a biology major. I like science. How did you get the knowledge of different careers in medicine other than MD or nurse? Because when you think of medicine, those are probably the two that pop up in everyone's head.
Absolutely.
MD or nurse.
Right.
So how did you find this new track for yourself?
So for me, it was more so just getting involved. While I was at Shaw, I had the opportunity to get involved with the pre-health clubs there, and actually became the chartering president for the Minority Association of Pre-Health Students. So Shaw University had a program, but it wasn't directly designed for healthcare students or science students that have an interest in healthcare. And because the school, in a sense, was very PhD driven or MD driven. And so I wanted to look into different avenues and see what other professions are available. So getting involved with that program allowed me to see different professions. And then just Googling.
Google?
Dr. Google is our friend these days.
Dr. Google. So you said, what did you Google? What was the term? Other careers than doctor?
Right. No. So basically, just Googling like allied health professions or
health professions
or healthcare professions.
Right.
And then just going to their their board websites and looking at all the different professions that are available. So that's one avenue I went about it.
Did you go to career services or your career center at your school at Shaw?
I did. So yeah.
And then did you explore that there?
Yes and no, I did. I mean, more so career services. I went there for my resume.
Okay.
So they were very strict on your resume at Shaw. Yeah. They got you together as far as like how your outfit should look for an interview.
Yeah.
But it was still a new phase and horizon about people trying to pursue certain professions because, they knew if you wanted to be a medical doctor, they knew where to take you. If you wanted to be a nurse, they knew which direction they wanted to take you. But when you had a broad spectrum of knowing what you wanted to do and looking into different avenues, that was somewhat still been in the works. And so it took me actually shadowing and having shadowing experiences to get involved with that. So
who'd you shadow?
So I shadowed Dr. Clarence Stewart III. He was a podiatrist, and he is a podiatrist in the Raleigh, North Carolina area. Really great podiatrist.
So podiatrist, though, that's the MD, though?
DPM. DPM,
okay.
Yeah, Doctor of Podiatric
I'm about to say some really ignorant stuff because I don't know what I'm talking about.
It's all good, man.
But by shadowing him, what did he teach? Like, what did he show you or tell you about the alternative paths in medicine?
Right. So shadowing him was more so getting that exposure to healthcare that I wanted to see. So being in his office and seeing him treating patients, seeing surgical procedures because podiatrists do surgery.
I'm already like cringing. We're gonna talk about that later about the blood and guts. But you shadowed the surgeries.
Yeah, man. So I got a chance to see all of that in undergrad, and so originally at one point I was thinking, oh yeah, this is definitely what I want to do. I want to be a podiatrist.
Okay.
But in reality, I realized that it was more so me enjoying just healthcare in general, and not necessarily that particular specialty, because that was what I was first exposed to. Seeing someone that's looking like me.
Okay.
Those had a lot of influences.
They do.
Yeah.
So that's definitely true. So you're having this coming to Jesus about your career, and you're like, I love medicine. I love this. Why not go the full doctor route?
Right. So yes, I definitely get that question a lot, and I feel like that's one of the true nucleus of this whole thing, in a sense, like all the different career choices, and why not MD? Yeah. And so many people, like you said earlier, they maybe not necessarily understand like medicine, and like understanding like the difference between, I guess, like physician and nurse, or that's maybe all they know, physician and nurse.
Yeah, like I heard physician assistant, PA programs. I know about nursing because I worked for admissions. I mean, and I knew a lot about allied health because I was recruiting for VCU. But I think the only things I knew of was the dentist school, the radiology stuff. But we don't have PA school. But you're right. It's not like when you hear allied health, it's not like you had to like really research. It doesn't just
pop out at you.
Yeah, pop out to you. So go ahead, man.
Oh yeah, man. So going through that experience, I realized that I had to like try to learn the difference, like what's in between, because because where I'm from, even with my family and friends, if you hear nurse and they're not a nurse and they're a doctor, if they're not a doctor, then they're a nurse.
Exactly.
You don't know that wide spectrum in between, and like I said, for the longest, when I was younger, that's what I realized and thought that's what I wanted to do.
The doctor one.
Exactly. I thought I wanted to be a physician, go this route, do all these measures. But in reality, I realized that wasn't my dream. That was the dream of life pressures, societal expectations, and regrets of other people by not following their own calling.
For sure. Because, I mean, when you think about it, we're talking about societal pressures. Like, there's a big, like, you made it stereotype. Like, right? Like, you're a doctor, you made it.
Exactly. Right? And that's the thing.
You attach that doctor to your name. Oh, man, hey, he the man.
Right.
And then it's also a lot of respect with nursing, because you're in the field, you're grinding, like a lot of respect for nursing now, especially in, I guess, culture and entertainment. Like nursing have like Jack, was it Jack Nursing? No, the shows. You about to? I'm Nurse Jackie. That's what it is. Nurse Jackie.
Dr. Jackie.
Is it? No, it's Nurse Jackie.
You talking about Married to Medicine?
No, I'm talking. Oh. Yeah, I'm talking about the one with the on TNT. I don't know. Point is, in entertainment in the society, you're showing all these doctor shows, Grey's Anatomy, and then they're showing all these and it's like you're right. There's a societal pedestal that we put doctors on, and it's, and that's it. Like if you want to study medicine, that's it, and then you gotta, like you said, attaching regrets and all that. And societal pressures to be accomplished with doctors, right? Yeah. But that's not necessarily the case because there's a wide range of professions.
Exactly, and they're all important. Right. They're all important. They're all required because, in a sense, with my profession, for example, like being in surgery, a surgeon will not be able to do his or her job, without her team. Right. It requires a full team. Like, for example, just surgery alone, you're going to have at least a minimum of 5 people.
True.
You're going to have anesthesia.
Yeah, okay.
You're going to have the surgeon assistant, a surgical assistant.
Yes.
You're going to have the surgical technologist. Yep. You're going to have the nurse.
Yeah.
And then the surgeon. The surgeon is the last to come into the room.
I don't even know what they do. Like, just 2 seconds. I remember when Maggie gave birth to our 2 kids, I think we legit saw the doctor for 2 seconds. You know what I'm talking about? We saw the nurses and everybody else, and then they did the chart, and then the doctor was like, okay, push 2 times, the baby came out. Like, what you do? You're right, it's a team. The team did most of everything.
All those steps of her becoming more and more dilated. It was exactly. Another whole team. Right?
The doctor wasn't there until the end.
Right.
Doctor, and then you get the paycheck though. What? So go back to your story.
Yeah, man. So I was just saying, with that alone, all those people that's in the OR, the surgeon comes in last, and they're the only one that has either an MD. Medical doctor, or DO, which is Doctor of Osteopathic Medicine, or DPM, Doctor of Pediatric Medicine.
Yes.
But everyone else, masters or bachelors, mostly master's degrees holders. Right. For example, anesthesia. That's a nurse anesthetist. Not necessarily an anesthesiologist that's putting you to sleep.
Wow. The anesthesiologist might be the one that knows the ratio, what the drugs to give you, but they're not giving you the drugs.
No, so the nurse anesthetists, they know the ratios and stuff too.
So what is that?
Exactly.
What do they do?
Yeah, and
that's crazy.
Yeah, nurse in the state of Virginia, nurse anesthetists can practice, solo in a surgery center and also some hospitals.
So what would
the anesthesiologist is more the anesthesiologist still very vital role to the nurse anesthetist, but they provide more so supervision, assurance. Into a certain degree, but as far as practicing, a nurse anesthetist can practice individually.
So pulling it back, you're saying that you can be obviously just as accomplished as I'm very proud of you, and you're very accomplished.
Appreciate it.
But you can obtain this level of professionalism in a wide range, and it's not this polar. I guess I'm not saying polar opposite, this all or nothing.
Exactly.
There is I like the term you said, there was a middle ground. Can you explain what does that middle ground mean? Just not as much school and a lot less stress. What was that middle ground for you?
Got you. I truly feel like the middle ground for me was just when I realized this is where I belong, was my schooling.
Okay.
Going through where I went to school, I went to Eastern Virginia Medical School in Norfolk, Virginia. We kind of been in the news a lot lately.
Yeah, we've been in the news lately. Shout out to the governor, and not a good shout out, but it's a program.
Yeah, so that's.
I'm sure your yearbook was a lot different.
Well, actually, our yearbook canceled out.
Yeah.
But yeah, so going through school there and getting exposure to all these different specialties was somewhat of the middle ground for me. I didn't have to pick just one specialty. I can be involved with obstetrics and gynecology, orthopedics, general surgery, vascular, you name it.
These are all the majors and concentrations.
Exactly. So you have a rotation on all these different specialties, and even when you start practicing, I don't have to pick just one specialty. I can, and I can always shift down the road. Versus physician, they have 4 years of medical school, and then they have 4+ years of residency,
Yeah.
4 to 7+ years of residency, depending on the specialty.
Right.
So they're not going to pick another specialty.
They're locked in.
Exactly. They're basically locked in the sense. They might do a fellowship, but that's
Correct.
maybe like an additional year or two. So with that, I like being exposure to all these different specialties. To a sense, it's like I'm having my chocolate, my strawberry, and my vanilla ice cream flavors like all in one.
Different ice creams.
And that's what I like about my profession, is that I have a variety. Each day is a new journey, it's a new experience.
It's a lot of learning too.
It is a learning curve.
Because you had to learn new things,
Exactly.
different things. And our other brother D-Tron went to the same school.
Right. So yes.
And how did his path lead to him to pharmacy? Because then he studied something different than you.
Right. So So D-Tron studied public health.
And so they had all kinds. Okay, they had
all
public
different
health.
professions. Right. So he got his
And then
master's
you
in
can
public
go
health.
from. Oh wow. Okay. So it's quite a school of different things you can do there.
Oh yeah, absolutely.
What other? I mean, is there other schools in the nation that's similar to that for the listeners? Like, is there only one like that in was it Eastern Virginia? Is there only one like that, or is there other schools that had the same thing? And if so, why'd you? Obviously, you picked that because you're from that area,
Right.
and had exposure to that. But was there other schools like that that you looked at in your research that did the same thing for kids that want to do that?
Right. So for my profession,
Yeah.
Eastern Virginia Medical School was somewhat, even though there are 11 different schools nationwide for my profession, but Eastern Virginia Medical School set the standard for me.
Okay, but it was 11. Okay.
It's 11.
Okay.
But Eastern Virginia Medical School was it's number one in the
Okay.
country.
Shout out VA.
Yeah, in the country.
Now. Okay.
And it actually also was the first school
Okay.
for surgical first assisting.
Okay.
So that was like somewhat.
That was a choice.
Yeah, yes,
Got it.
absolutely.
And you're homegrown.
Yeah, and also EVMS is the first school that changed it to a master's degree, because it wasn't always a master's.
What was it before?
It was a graduate certificate.
Okay, graduate certificate. So they added more classes to give you a master's.
Exactly.
Got it.
Yeah, because in many professions, like how everything is shifting now, like physician assistant programs weren't always master degrees; they were bachelor degrees, and then graduate certificates and masters, and anesthesia, nurse anesthetists are now master degrees, and some are converting it to doctorate degrees now.
Jesus Christ.
It's always changing.
School and money.
School and money.
Yeah,
exactly.
man, they're gonna get you money. So you're going through. Were you always good in science?
Science, yes.
And were you always drawn to it? Were you Were you always in did you take AP and IB or whatever you call it in high school? Or?
No, I didn't. I didn't take AP. I took honors. So for us,
honors,
so it was broken up. We had honors and we also had AP. And so I took honor science. But yeah, I loved science.
Okay.
Math was a love and hate relationship.
Yeah. Which one you hated?
Relationship.
I hated all of it. So
yeah.
Stats, I was trash. I was in all of it. So.
Oh yeah, statistics was a huge no for me. So
but what, trig was all right?
Trig was okay. Yeah, trig was okay. Algebra was okay. Calculus was hit or miss. However, that's one reason why I picked biology.
Okay,
I wanted to be a chemistry major, actually, but I decided to minor in chemistry instead because at Shaw, in order to be a chemistry major, you had to go all the way up to Calculus 3.
Yeah, of course. Yeah.
And biology, I could stop at Calculus 1.
There you go. Shout out to biology.
Okay, so I stopped at Calculus 1. I was like, I'm not going any further.
No, it makes a big difference. That's why I'm a history major. I had to take a foreign language. So you had the love for science was there.
Mm-hmm.
Were you a dorky kid? Did you do science fairs and travel? Or?
No.
It was all over the place.
So I was involved with DECA. Have you heard of DECA?
Yeah. That's the marketing one.
That's the marketing one.
There's FBLA and there's DECA.
Exactly. Yeah.
Okay, so you did DECA.
So I did DECA. So I wasn't really involved with healthcare stuff in high school.
But you was involved with having a sale. I know you were a salesman. About DECA. Did you go to the tournaments?
I did. I did. I actually was DECA district president.
Of course. Man, see, look at it. Of course, a leadership role. Of course, man. Yeah. So you were involved in that. Now, as you know, I'm all over the map, so I'm probably gonna go back to this. Mm-hmm. You're Mr. Shaw, right? I think you're 30 for 30, 30 under 30. He's before you correct me, he was nominated for 30 for 30. He didn't feel like paying the money or whatever he did. I
missed the deadline.
You missed the deadline.
The application deadline.
So tell me, let's go back to college days.
Mm-hmm.
I want to talk. So Shaw was a great experience for you.
Absolutely.
I'm gonna kind of go on two tangents. One tangent is talk about the HBCU experience, because I had one at Bowie and then I went to JMU. Talk about the HBCU experience in regards to your fostering of science and medicine, and also talk about going to HBCU and who was your mentors and people that you looked up to at Shaw, particularly.
Got you. Oh man, I don't even know where to begin. It's so much to even say just about Shaw University in the room.
Okay.
Yeah, Shaw is my home.
Okay.
Yeah, Shaw.
How'd you find Shaw? You could have went to Norfolk State. I mean, you're from Virginia. And You
Right.
could have picked any HBCU.
True.
Could have went to Hampton. Why'd you pick Shaw?
Yeah, so Shaw was a family school. I actually had a couple aunts that went there, and
Okay.
then also I had two cousins that I was graduating with from high school at the same time, and also two great friends from high school were
Okay.
actually going to Shaw the following year.
Okay.
So it just kind of just worked out. So I already knew I had people going there, so it's like
Okay.
a comfort zone kind of thing.
Okay.
Yeah. But yeah, being at Shaw University was one of the best experiences and decisions I could have ever made.
Okay.
When I first got there, I was a little hesitant. I was like, I don't know if this is for me, just because being away from home.
Okay. How far is Shaw from the Tidewater? From where y'all at?
Oh, it wasn't far at all. Actually, it was like that says a lot though about the culture there.
Well, don't tell me it was 45 minutes.
No, it was about 2 hours.
Okay, that's still far away. I mean, that's far enough. I thought you was about to say, "Oh, it's not far from home. It's 45 minutes."
But I was home my freshman year. I was home almost every weekend.
Okay, I understand that. I did that at Bowie. I was homesick.
Yeah,
so I can't lie.
Home every weekend. But the experiences and the nurturing environment that's there is like no other.
Okay.
And like I'm still in touch with like professors that are my mentors and people today, just by what they poured into me.
Okay.
Yeah, I wouldn't be where I'm at today if it wasn't for my foundation at Shaw University.
So what about you said the mentorship? And you mentioned a couple of doctors and stuff. Who were those mentors in science?
Right.
At Shaw.
Right. So yeah. So two or three of my professors of science were great mentors for me. Basically, meaning that they poured into me and went beyond just their role or what was required of them to teach or to advise. Like they taught and advised, but also went beyond and made sure they took extra steps to help me get to like my goal and where I wanted to go.
And can you tell me some of those extra steps that they did as a mentor? What did they do? Like
so basically, like for example, if they didn't have the resources, they knew who to put me in touch with. And then if they didn't have the resource for that, they Dr. Googled themselves and found some information and say, this is what I found. You should apply to this. This is what you should do.
Perfect.
So when it came to like internships, when it came to like shadowing experiences, like just getting all that additional information that I needed that I wasn't maybe too sure of or privy on, they were like, okay, yeah,
they would email you and they say, yo, this is what I'm thinking. Hey,
absolutely.
LaMarcus, I thought about you randomly. Here you go.
Exactly.
And you see them on campus, though.
And seeing me on campus. And so looking at me more as a name versus a number.
Perfect.
And then to the point that when they did see me as a name, it was basically like a name that they were constantly thinking of after their 5 p.m. shift. It's like they're going home and they're still thinking about me and, putting in work as well.
Yeah. I mean, that's a big difference. Was your classes small?
Oh, yeah. Classes were definitely small.
Like 20 people?
Yeah, 20 people were about the average. And the sciences, it was even smaller as we went up. So once I was in like microbiology and genetics and so forth, it was even smaller.
Like what, like 10 people, 15 people?
Oh, 15, yeah.
That's history. I was a history major, and I was like not the popular major at JMU. So by the time I got to my senior class, I loved it because it was encouraged. Like all the professors knew my name, which your boy loves attention. And then it was like small. It was encouraging talking, and I stay in touch with my top professors too, which I think that's where I like the line of education. I mean, the lines is blurred because like there's really no like I say no boundaries. There are boundaries with students, but at the same time we're all adults. So I have like an adult relationship with professors. Like if I really wanted to go out for a beer with them, I could, because I'm over 21.
Exactly.
So I do understand that. Like
I can learn to understand you.
No, thank you. I don't know what that was. That was Siri. Siri tried to jump on the episode. But it was good to have the mentorship and people that thought about you. So was science a popular thing at Shaw? Popular major? Like certain schools are different. Like I would say in most schools the most popular major is business because all the alumni make the most money and they put usually I would say in every college, the business school is the nicest building, or the engineering school, because it's based on alumni giving back.
Right.
But what was the science buildings like at Shaw? Was that like kept up?
Yeah, so the science building, I would probably say the science building and the education building was probably the nicest buildings.
Oh, that was the nicest building at Shaw?
Yeah, the science building.
Okay.
Yeah.
Why so? Well, science, STEM, everything.
Exactly. Yeah. So you have grants, you have research, grant money and so forth and stuff. So that's a huge difference. But yeah, the most popular major was probably business and education.
Okay.
And of the sciences, biology was the most
okay.
And versus chemistry and physics and then engineering came.
And what did computer
science?
What a lot of the alumni? I'm not asking you to put on statistics, but what about a lot of your classmates? If you did keep in touch with them, what did they end up doing from the biology major?
Oh yeah, absolutely. So the science department at Shaw University is really doing it.
Okay, shout them out. They're doing it.
Okay, they're doing it.
They get money.
They get money, right?
I mean, they get the donations back. All right, good.
Well,
shout out to Shaw. No, we're gonna put the link.
right, exactly.
Donation later. All right, so they get the money.
Yeah, they're working on their doctorates. You know, you have we have some veterinarians. We have a couple research doctorates. They're getting their PhDs in biomedical science and biomedical education, health sciences. They're working in the nursing. They're getting their degrees in nursing.
And these are some of your colleagues and classmates.
Exactly.
And they're doing all kinds of stuff on the spectrum.
Absolutely.
Did anyone follow the same path as you?
Not the same path as me, no. So
unique.
So I'm unique, yeah.
Okay.
But yeah, so they're all different routes. For example, my best friend, she's a pathologist assistant.
Okay. Where'd she go?
So she went to West Virginia University.
Okay, that's the one I seen her on Instagram. Or your
you probably
Yes, I saw that.
Yeah.
I stalk you, LaMarcus.
Okay, I see.
But that's cool. So you stayed in touch with some of your classmates.
Absolutely.
Excellent. And then
then my other good friend, she's a forensic scientist.
Yeah.
So she works with like autopsies and fingerprints and so forth. And
yeah.
So people are really doing different things. Of course, it required additional education.
Okay.
Beyond the bachelor's in biology or chemistry and so forth, but still the foundation that Shaw put into us, I think, really helped.
Can we talk about the garbage stereotype about less than for HBCUs? And we're gonna do that. We're gonna go there because, I mean, obviously, we're rooted in a racist system. I ain't gonna lie. I went to JMU. So I went to a PWI, but I also at the same time, I never disrespect any other institution.
Right.
Whether PWI or a historically black institution. For me, honestly, I don't think any college should be put on a pedestal because you can go to Harvard or you can go to Yale or you can go to Bowie State or JMU and excel at every school and do something. It's more about the person than the actual name of the school, the brand.
Right.
Because you can go to Harvard and flunk out and be trash.
Exactly.
Or you can go to community college down the street at Nova Community College, do what you got to do, go to the next school, VCU, JMU, whatever, and excel because it's about the person. But let's dial back. In your medical profession, and you was applying and meeting other alumni of, let's say not alumni of Shaw, when they hear about your undergrad, do you get, there you go, do you get some shade?
Oh, yeah, I get shade.
Okay,
Absolutely.
so let's talk about that. And I want to discredit that shade because obviously you're accomplished. So you're showing that you can be accomplished at any school.
Absolutely, exactly. I mean, people try to sleep on institutions that maybe are in the news for financial situations sometimes or, in the news as being smaller or because they're giving maybe, not at a certain quote-unquote amount compared to other institutions and so forth. But in reality, it's all about the education that you're receiving. And like you just mentioned, you can be at Harvard, you can be at Yale, and still have you're going to still have those same adversities.
Yes.
And the one thing that I love about Shaw and my experience is that they prepare you for those adversities in a sense.
Which ones they prepare you for? I like that.
Just basically in a sense real life adversities. Like you're not going to have just easygoing transitions all the time. It's going to be some type of situation where you're going to have to get up and say, okay, why you can't find this paperwork? You're going to have to get in line and do this. You're going to have to get in line and do that. You're not going to have the library resources all over, available 24/7,
Right.
is going to close at 11 o'clock.
Right.
So you're going to have to go ahead and get in and get your research, get the things that you need to do.
Right.
That true understanding. So for me, leaving Shaw and then going to EVMS, that was a predominantly white institution. I was the only black man in my class.
Okay.
And
let's talk about that. Yes.
That caused it. It was a shift.
How was the transition for you for that? Was it hard?
It was slightly hard, just because, one, when I graduated from high school and went to Shaw, it was slightly a culture shock.
What kind of high school was it? Was it a mixed high school?
It was mixed, but it was still predominantly white.
Okay, the high school was.
Mm-hmm.
Okay, and then you went to historically black. Okay.
Exactly.
I understand that shift. I went to a 50-50 school, Mount Vernon. Then I went to Bowie State. So that was a little bit of a shift for me.
Yeah.
But then that's not that much. Now, I would say this, though, and no shade to Bowie State, but I felt like Bowie, to me, at my time at Bowie, was easier than the PWI.
Mm-hmm.
And I don't know if that was just me or being an IB, but Bowie was easier to me. When I got to Bowie, I was killing it.
Mm-hmm.
When I got to JMU, I struggled a little bit. I don't know if the academics was harder,
Mm-hmm.
but that does not take away from the experiences and the teachers and the professors. I don't know. I don't know if that's a sense that I got.
Mm-hmm.
But with that being said, you could be the man I know the people that were the man at Bowie, and then they could just continue to prosper.
Mm-hmm.
And then I know people that were just average at JMU, and they're just average in life. So it kind of goes to the point where you do whatever situation in school you go to, it don't matter the name of the school that they slap on there. It matters if you get involved. If you're like I'm hearing from you at Shaw, you were doing the organizations, meeting professors, and all that stuff. So if you go to any school, and get involved as a student, you should do well anywhere.
Absolutely. I mean,
it doesn't matter what the name of the building is.
Absolutely. I mean, I'm a true believer that, basically what you're putting into the universe is some of what you're going to receive.
Yeah.
In a sense of, if you're looking at an adversity situation with positivity, you're going to look at it as a positive situation.
Yeah.
Misfortune is only misfortune if you give it that power to a certain degree. So, my experience at Shaw University, it was things I didn't like with any institution. Certain things you're not going to like, the frustrations.
Yes.
But the things that I was looking at it personally, because I'm thinking it was an HBCU experience, or because it was a smaller institution.
Yes.
When in reality, getting to EVMS, I realized it's not necessarily a HBCU issue. It's just an educational issue and component and piece, because my science foundation and the rigor that I received, in microbiology, for example, at Shaw, we had to learn the whole glycolysis pathway and learn that mechanism forward, backwards.
First of all, you just hit a big word on me, so I know you did that. I know you studied on me on a big word. I didn't know what that meant, but that means you did some science.
Yeah, so we were drilled.
Okay, you were drilled. You were prepared.
We were drilled.
And they wanted you to be prepared with that background, that foundation knowledge.
Yeah. So going to EVMS, and people trying to act like, oh, what's Shaw University? Where's that? Is that one of those black schools?
Yeah.
Those type of things.
Wow, Mike. And they said they didn't say it like that, but they said it like that.
They said it like that. Yeah. Is that one of those HBCUs? Like,
Yes.
You know what I'm saying? So, and then, when I'm being able to, speak the same vernacular as them, and also discussing these things and breaking down the pathway when the microbiology there, not saying it was, mediocre, but it was by all means not as rigorous as what I received at Shaw. And so other science classes, so having that strong foundation truly prepared me, and it was the confirmation that I needed to know that I belong here, I can do this.
I like that.
The values is within yourself.
And I like that. And the hardest thing, too, is the part, and I struggle with this too, and this is just being totally transparent. You said something really powerful, is that I notice I belong here. The imposter syndrome, where you feel like you're accomplished, but you deserve to be accomplished because you put in work. And so one of the things I'm working on mentally is that sense of imposter syndrome. Is whatever room I'm in, whatever situation is, I am prepared for it. Therefore, I'm not a fraud. Like it's called imposter syndrome, where if you feel like, and that really touched base, is that when you go to situations with high achieving people or high pressured situations, and you are prepared, you belong there.
Exactly.
And I like that you said that. Like you were saying, like Shaw gave me the foundation that when I went to this school, I belong at the seat at the table. I belong at what is it, whatever?
EVMS.
Yeah, I was about to say, I can't know acronyms.
It's a
But you
wrong
belong there.
I did. I belong there.
And you belong there because of the foundation that your instructors gave to you, the studying and stuff like that. Did you feel, and I feel this too sometimes, do you feel as a black male that you have to work harder to prove that you know something when you really don't have to prove anything?
Absolutely.
You know what I'm saying?
Absolutely, hands down.
Like, I had to prove more science.
Yep.
And I was like, but everyone should know this science. I don't why I had to prove that I know it. You know what I'm saying?
Right.
Absolutely. You know what I'm saying? Like, why do I have to prove I know this content that everyone should know, and no one else has to prove that content? You know what I'm saying? Like no one else is getting quizzed like this. You
Exactly.
know, or feeling like that is. Can you explain that?
Oh yeah,
situation
absolutely.
At medical school.
Yeah, I mean, I had experiences where I would answer a question or go through something, and then the professor would ask, "Oh, where did you go to school again?"
Oh no.
You know, professors. You know,
Yes.
so it was just like that was a,
I mean,
it's a little
And I
different.
don't know. Maybe it's a unconscious microaggression,
Absolutely,
right?
and that's the thing. A lot of stuff that we do it unconsciously. You know, just like how I feel like one thing that I was talking earlier about, people, and sometimes in medicine we put it such on a pedestal that they look at it as people start to get somewhat narcissistic and egotistical about, professions and thinking their profession is better than someone else's.
Yes.
We kind of somewhat do the same thing in a sense of, them thinking like, oh, they clearly must not know this. Statistics says this and that. Statistics say that they're not good test takers. Statistics say that this and that. Statistics say retention. Statistics say all of these things, to the point that you're now looking at data. You're looking at all this news. You're looking at all these other things versus looking at the person.
Right.
So sometimes you're slightly coming off and saying something without even sometimes realizing
that
you're coming off kind of disrespectful and rude.
For sure. Dang, I like that. I mean,
yeah, because I've had surgeons sometimes. Like, I remember finishing a surgery, finishing a case when I was in school, and they'll say, "Oh, you're really good at this. Why aren't you becoming a surgeon? Why are you not in medical school?" And so at that point, it was somewhat of a compliment, but also an insult.
It's a backhanded compliment.
Exactly.
That's what we call a backhanded compliment.
Yeah, backhanded compliment. It's like compliment and an insult, because you're discrediting my profession. You're discrediting what I'm doing. And so, in a sense, to glorify what you're doing. And
like, oh, doctors, why don't you be like me?
Exactly. And so at that point, that's when I realized that a lot of times they're not even realizing it, just because of society and their own mindset, their own thoughts are rolling. They're not even realizing sometimes, I think, the things that they're saying. And sometimes if you just stop and breathe, I could have went off. I could have said, "Excuse me, how dare you?" But at the same sense.
Yeah, so how do you professionally clap back?
Yeah, well, professionally clapping back. Yeah, I just think,
for the listeners, I joke with LaMarcus, but LaMarcus actually is the king of professional clapbacks. Where I've seen an email that brother.
Don't call me out on that.
Yeah, I've seen it. I've seen an email where he hits you with the per my last email. So I know you use it, and you said it. I'm gonna start using that word too, like. Vernacular, he uses the vernacular to make sure that he comes correct, where he professionally puts you back in your place.
Hey,
we call that the corporate professional clapback.
Yeah, you got to do it sometimes. How did you professionally address someone when they said something backhanded like that? Yeah, well, more so if it came from someone that's a team member or someone that's in medicine or healthcare, I some would look at it a little differently, meaning, okay, you're thinking what I'm doing is not good enough, versus someone that's externally looking in, just wanting to clarify or wanting more information. And so when someone that's internally asks that, the old me, someone would be a little bit more,
he's reformed.
Yeah, it's some change, it's some growth.
He found Jesus.
I found Jesus. Yeah, I found Jesus moment. The old me I would have been like, oh, so my profession isn't good enough, or something like that. And of course, they try to correct themselves.
Oh, so sorry. Yeah.
But the new me now is, I'm basically saying, I thought about it, but honestly, I love what I do.
There you go.
Or I'll say, I thought about it, but honestly, I don't want that kind of level of stress.
There you go. That's
it's all different little things. And
you got them.
Yeah, because, honestly, I came to realize that a lot of people are in certain roles and professions because of society and pressures of life. I've worked with many physicians, and a lot of them are unhappy.
Okay.
It's a wonderful profession, but still they're unhappy. That they wish they would have did other routes or maybe picked a different specialty instead of not trying to chase income, or not trying to chase a level of privilege or prestige, thinking that this will give them a sense of entitlement. Those little things like that is what some people drive on.
Sure.
And me personally, even when I was started working and was in my profession and started seeing these paychecks, and I'm like, oh my goodness, I'm not used to this.
Okay.
And to the point that I'm now like trying to work even more and taking more call shifts. Oh, I'm available.
Right.
Working 70, 80 plus hours a week.
Burning us out.
Exactly. Just because you get so addicted to certain things and customs.
Right.
But in reality, more money, more problems.
Oh snap! You hit him with the biggie.
You gotta hit it sometimes. More money, more problems.
Wow.
And it doesn't bring happiness.
No, it doesn't.
And so when you try to focus on those external things to be personal drive, that's when you run into issues.
Yeah.
That's when you run into burnouts and overwhelming and insecurity
Yes.
issues and all these things. But when you're truly doing it for your peace and your happiness, hey, you're gonna always be good.
Are you a lifelong learner, and are you in this field, since you're a jack of all trades? What are you continuously learning? Because you say you're learning new things all the time. So how do you stay up on learning?
So it's truly a lifelong learning. So like I don't get rid of my textbooks for one.
Okay.
I'm a true believer that
you shouldn't, because all the money you pay for them.
Okay. And one, I wouldn't get no money back for them.
Exactly. Yeah. So you don't get rid of your textbooks.
They be redoing them every 2 years.
Exactly.
But I don't get rid of my textbooks. I open up my textbooks time to time. And two, you have to, with my profession, you just have to stay on top of the latest new technology, the latest new medicine. So going into conferences.
What professional organizations you belong to for these conferences?
Yeah, so I belong to the American College of Surgeons, ACS, and also I belong to the National Surgical Assistant Association, NSAA. So those are two.
All right.
So with that, I just try to stay abreast of different things. That route. And then also I'm still in school. I'm currently working on my doctorate.
Oh my gosh.
No, man.
God, I'm done. You're not done. I'm done.
No.
I got a master's. I'm done. So what's the doctorate in?
So I'm working on my doctorate in healthcare administration.
So that's to run the hospital, basically, the business side,
right? The business side, the administrative and business side of things.
Okay.
Because I love being a clinician. I love being in the OR and practicing, but I want to also get the academic component.
There you go.
The academic component, because I want to eventually move into the academic realm down the road.
Yeah, and we touched upon the different realms. There, in every industry, there's different realms. So there's the business side, there's the education, teaching other people side, and then, as you say, the practical, or I guess hands-on side.
Exactly.
So you are leaning toward now, Mr. Deca. Back in the day, you bring that Deca back.
Bringing the high school Deca moves back out.
So what's the money part? What does that attract you about? Not the money as in money, income, but the running or the systematic part of healthcare that attracts you. Because obviously, it's running a hospital is like running a organization, right?
Right.
What attracts you to that part, to go to this route?
To me, it was more so just health law.
Okay.
The health law and the medical ethics component of healthcare. Like, the Affordable Care Act changed the game completely. From how providers are able to practice, how providers are able to even give medicine and treat. Their timelines and time frames on things, how the health insurances, run things. So it was basically a true learning curve for everyone. And so at this point, is a huge demand for healthcare administrators, versus not necessarily to run hospitals, but to run healthcare agencies, to run outsourcing agencies, to run and be involved with the politics of health law, to understand where we're going and understanding the gaps of what we're missing in health law and health education. So that was interested me in it, and I felt like I could truly get involved with this and still be involved clinically, for a good amount of years, and then eventually just move into the realm of practicing administration completely, and then also academic-wise.
Well, and then you want to teach too.
I do. So yes, I'm actually already lecture time to time back at my alma mater at Eastern Virginia Medical School.
You go down there to lecture?
I do.
Like how often?
Not often, maybe like a few times out of a semester. So 3 times a semester, I just give a couple lectures.
But you're back to going. You want to do that. I like teaching because I'm at higher ed. What do you like about teaching?
The engagement.
Yeah.
Yeah, the true engagement. I try to teach in a dialogue kind of style, meaning I'm not trying to belittle someone to the point, and that's why I like about graduate teaching, college and graduate level, because I'm going in giving them the mindset that I'm expecting them already knowing somewhat of something, and we're going to just add to it. We're going to add to
collaborators and learners.
Exactly.
Right there involved. You're basically not telling them what to do. You're collaborating with them. Like they should be involved in their own learning.
Exactly.
I like that idea.
So one of the lectures that I give is healthcare professionalism, where we talk about the importance of basically that, in a sense, the professionalism that's involved within healthcare.
So like resumes and stuff?
Not necessarily resumes,
like
but
social media presence. I mean, like
in a
professionalism,
exactly.
Showing up on time, all that kind of stuff.
Exactly. But also in a sense of like understanding their role and how they should carry themselves in a medical setting or in healthcare, in a sense.
You might have to give me some of the rubric because I need to teach this to our students.
Okay.
Just levels of professionalism in life.
Yeah.
I mean,
man.
What's one thing that irks you professionally about that, like that when you're teaching someone, like showing up late or something? Like, tell me something. Tell me a tip that's like a professional tip that they should learn.
Yeah, a professional tip that they should learn sometimes is just, I guess, watching facial expressions.
Oh, there you go.
Facial expressions is a huge one. And so in my profession especially, you kind of get a sixth sense when it comes to facial expressions because you wear a mask.
Yeah.
So you can learn a lot just by looking at someone's eyes and seeing like how the wrinkles rise up and go down, knowing if they're smiling, if they're angry, if they're looking at you like you're crazy, confused.
Rolling their eyes, yeah.
Exactly. So you can see a lot with that. And so with the lecture, I talk about that as well because that can sometimes be a break or make situation. You know, if you're on the elevator with someone and you have to give your elevator speech, if you're, in an interview, just watching your tone, your delivery, your facial expressions, all these little things that sometimes we know, but we don't think about. We don't really bring it to the surface because in our minds,
communication.
Exactly.
Non-verbal communication. Well, I don't know the percentage, but it's a lot. So, I mean, we're going in. This is a good episode, but I want to go back to the very root. How do you deal with the blood and guts? I can't. I legit. We talked about a whole episode of medicine, and I literally try to avoid it, but I'm not going to avoid it. Like, were you into that kind of thing when you were a kid? Did you?
Yeah.
When they dissect the frogs, you was okay with that?
That was my favorite day.
No, man.
Well, I could eat a sandwich and do it at the same time. No. I really could.
No, man. Like, what has been even grossed you out as a surgery, and you had to step out?
I haven't had a step out moment.
You haven't?
No.
Have you had a fainted moment?
No.
All right, dang.
I've had a moment.
You got the iron stomach.
No. I mean, I've had a moment where I had to get relief, but it was because I had just had a surgery and I went back to work too quick.
You were tired.
And I was tired, exactly.
Okay.
And I was feeling my fatigueness. I was feeling like, okay, I need
step out. You need to tap out. Nothing smell or nothing?
No, not this. Sometimes the smell can get to you because we use electrocautery.
What's that?
Electrocautery is like a burning pin.
Yes, okay, I've heard of that.
So we use that to cut through tissue and to also help get bleeding under control.
Oh, God.
And so sometimes when you're burning using that pin, it can get
What does it smell like cooking meat?
Oh, it gets smoky. Oh yeah, it gets smoky sometimes.
Have you ever on purpose seen if people have weak stomach and showed surgery on someone? I don't on TV. Can you watch it on TV?
Oh yeah, I can watch it on TV.
You watch that Dr. Pimple Popper thing?
I do.
I can't watch
Dr.
that.
Sandra Lee. Yes, I do.
I can't watch that. It makes me sick. I legit have the weakest stomach ever. I literally go dry heat. So we got a really good episode. We're really in. I'm saying that 2 times, but this is the part of the episode I'm not familiar. Have you listened to an episode before?
Mm-hmm.
Yes. So you know what's coming up. It's the shot for shot portion of the episode where we get to ask. You get to ask me any question. I get to ask you any question.
Okay.
It's not even related to medicine or nothing, and whatever.
Okay.
So, do you want to go first? Or I go first.
Okay, you go first.
All right. So, obviously, we have established we're good friends,
mm-hmm.
and we also are a lover of trash reality shows, being which we can range from Married to Medicine, which is not a trash show, but to back in the day the VH1, Flavor of Love. Rock of Love. I love New York. So, for the listeners, since we share this passion,
okay,
can you either give me 5 reality shows that you like and why, or 5 reality moments in reality show history that you remember, because we remember quite a lot. For instance, I'm already gonna steal one that I still quote to this day is is how broke Pootie was and he threw him down the stairs. Now for those that don't listen, just Google Pootie I love New York and they'll thank me later. So there you go, bro. Go, man. Brother Davis. You got your 5 reality shows.
Oh man,
Why you know I was gonna go there too.
Look, see, I really don't have those many reality TV shows.
Then you might have 5 moments then.
I'm
gonna count them all. I got my fingers up.
Okay, let me count my 5 moments. Okay, well I guess I'm gonna have to do it. I'm gonna do it based off of just one show altogether.
That's fine with me. Okay, one show.
So,
What's the one show?
So when Mariah and Toya got to fighting.
Which one is it? What show is this?
Married to Medicine.
Okay.
So this is when Mariah and Toya got to scrapping by the pool.
Okay. Can we YouTube these?
This is like season 1. Yeah.
Okay.
This is when when Mariah and Dr. Heavenly got into it.
This is Mariah. Yeah. I need to get into the show. I'm about to catch up.
When Quad and Mariah got into
it. How many times you gonna say Mariah?
Mariah be really getting into it.
Yeah. Okay.
Let's see.
We got 2 more.
I guess Dr. Jackie, talking about. Well, Dr. Jackie don't really be scrapping or nothing, but Dr. Jackie, she be throwing low key shade.
Okay. So yeah. Dr. Jackie's a character. Period.
Yeah.
Okay.
Exactly.
And the last one.
Kind of good one. Oh, Miss Quad. So of course, got to talk about Miss Quad and her relationship with Dr. Greg. Yeah.
So that's Married to Medicine, aka you're actually in. You get shout outs to them.
Yes.
On Instagram. On Instagram.
I do. Yeah.
Just he's famous. So that's his. He picked one from one show. So I've never watched Married to Medicine, but now I will because now I'm gonna look for them. Or if not, I'm just gonna look for the individual clips on YouTube.
Right.
All right. Free range.
Oh man. What made you want to start this podcast?
I was told I had a face for radio.
Okay, face for radio.
I mean,
I did.
No, quite honestly, I was used to do videos in my car, YouTube videos in my car, and then I realized it was boring, and I really didn't have a familiarity with podcasts, but I found out YouTube was boring, and I was like, I'm just talking, so let me rip the audio, and I really just like having a voice. I like podcasting. For me, it's like anything else. It's a hobby, but it's got a community like any other hobby. Like if you're in a bowling league, there's a bowling community, and as a whole, I like the social aspect of podcasting. Quite honestly, like connecting with people, having people like you share their story, and then like, hey, let's share something. Let's share information. And I love that aspect of podcasting and sharing information with people, and getting an opportunity to like talk on a mic, and it's my platform. It's my stage.
That's real.
Like I said, I told you before, you're a little nervous before this episode. I was like, nothing to be nervous about because the main people that listen to my podcast are my family and friends, and it's like this is like pretending like I'm getting on a stage, and the only people in the audience are my family and friends.
That's
and
real.
Eventually, I want to get into real public speaking with strangers, but I felt like for me, honestly, podcasting was practice because if I can talk on a mic to an invisible audience of people that I don't know who's listening, I'm pretty sure I can get on a stage. So
talk to anyone. Exactly.
It's basically having a platform. I tell anyone if you want to start a podcast and they're like, oh, the podcast market is saturated, so many podcasts. I say, who cares? Just talk. Like, find a subject that you would like to talk about. Mine is positivity and sharing other people's career stories. But find a subject you want to talk about and just be consistent about it. And basically, you have your own audience. Every episode is your own audience. And whatever you want to share with the world, you can share. Like, it's for big extroverts like me. I get to talk and share my ideas or share other people's ideas and share other people that I'm proud of, such as yourself. I get to share that and say, hey, you know what? People need to hear this.
Nice.
And then if they need to hear it, I got my own podcast, and no one can tell me no.
Right.
And I got no director or whatever. I'm my own director, so it's a way to share your message or whatever you want to talk about. And if I told people too, if it gets 1 download, it gets 10 downloads, it gets 5. It don't matter because I got to share what I wanted to, and I get to do it my way.
That's real.
And that's like, I think that's why a lot of people that are in radio are doing podcasts, because they don't have a station telling them what to do. You can do what you want. It's your podcast. Now, I mean, you can get in trouble and say stupid stuff, but it's your stupid stuff. It's your platform. So that's why. And that's kind of a roundabout way, but it's fun. If you want to start a podcast about Married to Medicine,
pass.
And your moments, you can.
Right, yeah. I don't watch
it's
TV.
fun. It's fun.
Yeah.
All right, so we're at the part of the episode. We're not really, I mean, we are done, but this is your lane. I call this, I want you to do your shout-outs and plugs. So anyone that you felt you want to give credit to that helped you in your journey for medicine, any shout-outs, and then any special ventures that you're doing for yourself. I'll give this, any your social media if you want people to follow you, but anything. You say no, not the social media, but anything that you want to shout out and plug. This is your platform.
Got you. So I just definitely got to give a shout out. Like I said, I already said Shaw University, but I didn't get the chance to mention the science professors that definitely made a huge difference in my life there. So giving a shout out to Dr. Vonda Reed, Dr. Diagradius Banks, Dr. Tashnian DeBroy. Those three were very instrumental when it came down to my sciences and helping me figure out different paths. And especially Dr. Vonda Reed, she was my professor. She was my advisor for my classes, my advisor for the pre-health club, and she even went beyond and helped me with finding internships, to the point that the podiatrist that I shadowed was actually her brother, Dr. Clarence Stewart III.
All right, shout out. Wow, that's that's small world.
Yeah, man. So shout out to Dr. Clarence Stewart III, Dr. Travella Sellers Wilkins, and also Dr. Rodney Fishew. Those three great podiatrists in the Raleigh, North Carolina area. Foot and Ankle Associates of North Carolina. If you need some work done, go see them.
There you go.
Those three. And of course, gotta give it out to my family and friends, of course. Got to give it to God. I would not be here where I'm even able to talk with you right now without God, without my family and friends.
Yes.
Because, sometimes adversity hits and sometimes you don't know how to handle it because you're so used to things going right and things going, right for you. So having that strong foundation with your faith and your peace and staying close to your family and friends are truly important.
Yeah, now I will do one more plug. I mean, plug for you. So, Valentine, there's a foundation or something for Shaw. I don't know, scholarship or whatever.
Oh yes.
Can you talk about that real quick? He dropped it. I don't know. It said something about. I'm blanking, but it was something about Shaw and it had something to do with you. I don't know. Maybe we'll get back to it.
It'll get back to it. Yeah, I'm not too
how
sure.
about 30 for 30? How about that?
Oh, the 30 on the 30 fellow.
Yes.
So yeah,
we're gonna be there. I'm gonna be down to 40 and 40 because I'm already past 30 years old.
So the Forbes 30 under 30 fellow came along. Very interesting, actually. I was in the process of revamping my LinkedIn account and changing a whole lot of things, changing my connections, following up with connections, and the VP of audience for Forbes actually contacted me through in my inbox in LinkedIn and wanted me to come to this event in Washington, D.C. It was going to be at the museum, and basically they were going to be just discussing a whole lot of different executive things, because that's one thing that I guess I didn't also mention is that I'm still in the OR, but I'm also practicing as an administrator. So I serve as the executive vice president of clinical operations for Phenom Surgical. It's a private surgical care practitioner practice in the Washington, D.C. metropolitan area. And so they reached out to me about coming to give some insight on my executive piece from a minority approach. Okay. I wasn't able to attend because I had death in the family. So I sent them an email, apologized, told them please keep me posted on future conferences and so forth. He actually responded back and he remembered me and kept in touch and told me about an event that was going to be in New York.
Yeah, I saw that one.
Yeah, and that was when I went to Forbes IDEA conference, and that was a minority executive conference to change the mindset of diversity and inclusion in executive places. So it got a chance to teach you about how to be board members, the process of being board members, of bringing people to the table, but not only to the table, but also giving them a platform to speak, to change your businesses and practices. So in that kind of how that started. And so once they realized my age and was networking and so forth, I just kept continuing being invited to different platforms.
There you go. And then you're going to be invited to more. And then when you are, I'm going to tag along.
Sounds good, man.
So, Marcus, this was great having you on episode.
Appreciate having me.
I think you shared a lot of knowledge about medicine and alternative career paths, which I think were very, very important. Definitely love having you on the episode. And you've been a big supporter of the podcast. So thank you so much. All the listeners of the podcast, you can like us or follow us on iTunes, or you can leave a voicemail at 571-336-6560. That's 571-336-6560. Thank you so much. Thank you, LaMarcus.
Appreciate it.
And we're out.
Out.
Thank you for listening to Positive Filter, a podcast that focuses on family, friends, career, with a little self-help along the way. If you enjoyed this podcast, please share it with your family and friends, and like the Facebook page, Spreading Positivity of Movement. Thanks for listening.